If you're watching this, chances are you felt that quiet frustration, that sinking feeling when your body just doesn't respond in bed the way it used to, or the way you want it to. The pressure to perform can be crushing, turning intimacy into a source of anxiety instead of pleasure. You might be seeing the title of this video. Give me 10 minutes, I'll show you how to stay hard, and wondering if it's truly possible to reclaim that confidence, that youthful vigor. As a urologist dedicated to men's holistic health, I'm here to tell you it absolutely is possible, but it's not about quick fixes or magic pills alone. It's about understanding the subtle yet powerful mistakes many men make in bed, mistakes that silently undermine their performance, their energy, and their intimate connection. Today, I'm going to reveal these 5 common mistakes, and crucially, how to fix them, giving you practical, actionable strategies to not just stay hard, but to truly reconnect with your pleasure, your partner, and your inner confidence, starting right now. Recognizing these evolving landscapes of male sexuality is paramount, and it reveals that many common struggles aren't failures, but rather the result of deeply ingrained habits or misunderstandings about how our bodies and minds truly work in intimate moments. That's why I'm going to share 5 common mistakes men make in bed, mistakes that once identified and corrected can profoundly transform your energy, performance, and vitality. Each of these mistakes offers a clear pathway to mastery, allowing you to move beyond frustration and into a realm of deeper pleasure, connection, and confidence. We're not just identifying problems, we're unveiling solutions that are both practical and transformative, empowering you to take back control. Let's begin by addressing one of the most pervasive and self-defeating habits. The first and arguably most common mistake men make in bed is over-focusing intensely on the physical aspect of an erection. It becomes this single, all-consuming metric of success. Is it hard enough? Is it big enough? Is it staying hard? This laser focus on the mechanics of an erection creates immense pressure, activating your fight-or-flight response, which is the exact opposite of what your body needs for sexual function. When you're in fight or flight, blood rushes away from non-essential functions like erections, perpetuating the very problem you're trying to avoid. The fix. Shift your focus from performance to pleasure and connection. Remind yourself that intimacy is a multisensory experience. It's about touch, sensation, emotional connection, communication, and shared pleasure, not just rigidity. Scientific studies, including those in the Journal of Sexual Medicine, repeatedly show that mindfulness and a focus on sensory pleasure significantly improve sexual satisfaction, even when erections are not always at their peak. Engage all your senses. Focus on kissing, caressing, gentle touch, and direct eye contact. Communicate with your partner. When you truly connect on an emotional and sensory level, the pressure diminishes. Your body relaxes, and often without even trying, the physical response improves dramatically. This mindset shift is foundational for all other improvements, allowing you to breathe more freely and fully engage in the moment following that intense focus on the physical. The second critical mistake men often make, almost subconsciously, is holding their breath or breathing shallowly due to anxiety. This is a direct physiological consequence of the fight-or-flight response we just discussed. When you hold your breath or take rapid, shallow breaths, you send a clear signal to your body danger. This further constricts blood vessels, spikes cortisol levels, and makes it incredibly difficult to achieve or maintain an erection. It creates a state of internal tension that directly hinders your sexual response. The fix: master conscious deep breathing before and during intimacy. Practice deep diaphragmatic breathing. Inhale slowly and deeply through your nose, letting your belly expand, then exhale slowly through your mouth. This simple act stimulates your vagus nerve, activating your parasympathetic rest and digest system, which is precisely where optimal blood flow and relaxation reside. Consider taking a few minutes before intimacy to do some deep breathing exercises. During the ACT, gently remind yourself to breathe slowly and rhythmically. This not only calms your nervous system and improves blood flow, but also keeps you mentally present, preventing your mind from wandering, which leads us directly to our third common mistake. As you've learned to focus on pleasure and breathe deeply, you might then encounter the third common mistake, thinking about something entirely unrelated, like your grocery list, your work, or even a baseball game specifically to try and prevent early ejaculation. This tactic, while seemingly logical in the moment, completely sabotages intimacy and often backfires. It creates a profound mental disconnect, robbing you and your partner of genuine presence and pleasure. While it might delay climax temporarily, it eradicates emotional connection and makes the experience feel hollow, leaving you feeling more isolated than before. The fix: cultivate genuine, mindful, this and employ control techniques. Instead of detaching, consciously bring your mind back to the sensations, to your partner, to the moment. Embrace techniques like the start-stop method or the squeeze technique. Both recognize strategies in sex therapy. With the start-stop method, when you feel close to climax, simply pause all stimulation until the sensation subsides, then resume the squeeze. Technique involves gently squeezing the tip of the penis to reduce arousal. These methods allow you to stay present, learn your body's unique arousal curve, and gradually build endurance without sacrificing connection. This control also leads you away from the trap of external solutions, like medications, which is our fourth crucial mistake as men seek solutions for performance. The fourth mistake many fall into is over-reliance on medications like the blue pill, Viagra, or similar PDE, 5 inhibitors. While these medications can be incredibly effective and life-changing for many, especially those with underlying circulatory issues, they are often misused as a primary standalone solution without addressing the root causes of the problem. This can create a psychological dependence, where a man feels unable to perform without the pill, and it can mask underlying health issues that need attention, such as cardiovascular disease or diabetes. Furthermore, these medications come with their own side effects. The fix: prioritize holistic health and view medication as a tool within a larger strategy, not the only solution. First, if you are experiencing performance issues, always consult your urologist or primary care physician. They can assess your overall health, identify underlying conditions like heart disease or diabetes, which often manifest as ED, and determine if medication is appropriate. But crucially, combine medication with lifestyle changes, a heart-healthy diet, regular exercise, stress management, and maintaining a healthy weight. Research in JAMA and other medical journals consistently demonstrates that lifestyle interventions are fundamental for sustainable improvement in erectile function, often reducing the need for medication or enhancing its efficacy. A pill can bring blood to the penis, but it cannot bring presence, confidence, or connection. And speaking of physical preparedness, that leads us to our final mistake: neglecting the very muscles that support performance. Finally, the fifth critical mistake men make in bed, particularly as they age, is ignoring how the body changes and not actively training or supporting the sexual muscles. Just like any other muscle group, the muscles involved in erectile function and ejaculation can weaken over time if not engaged. Many men resign themselves to a decline, never realizing they have muscular control. They can actively strengthen the fix, actively engage, and strengthen your pelvic floor muscles, specifically through Kegel exercises. These are the muscles you use to stop the flow of urine by consistently performing Kegels, contracting these muscles for a few seconds, then relaxing, repeating several times. You can significantly improve blood flow to the penis, enhance erectile rigidity, and gain greater control over ejaculation. Numerous studies, including a landmark one in BJU International, have shown that pelvic floor muscle training can be as effective as, or even more effective than some medications for improving mild to moderate erectile dysfunction and premature ejaculation. This is not about building big biceps. It's about subtle internal strength that directly translates to improved performance and sensation. Incorporate 3 sets of 1,015 Kegel contractions daily. It's a simple, discrete exercise you can do anywhere, anytime, and it directly addresses those physical changes with age, putting control back in your hands, your journey to lasting confidence, vibrant energy, and a truly fulfilling intimate life starts right now with these powerful, actionable insights. Don't let unanswered questions or a sense of resignation diminish your potential for a truly fulfilling life. Take action today. Be brave. Start by choosing just one of these fixes to implement daily. Perhaps it's a few minutes of deep breathing, or consciously shifting your focus to pleasure, or even starting those Kegel exercises. It's a small, tangible step you can take immediately to reclaim control. And if you have persistent concerns about your sexual health, schedule that long overdue checkup with your urologist or primary care physician. Discuss your symptoms openly and take control of your health. Your emotional peace, your physical health, and your intimate happiness are absolutely worth this vital step and the liberation it can bring. If this video has brought you clarity, understanding, or a spark of hope, please take a moment right now to hit that like button. It genuinely helps us know we're delivering content that truly resonates with you, our cherished men's health community. More importantly, please share this vital video widely with every man you know, your friends, family, colleagues, anyone who might be quietly struggling with performance anxiety, or simply seeking trusted, natural advice. Intimate Wellness, your simple act of sharing, could be the turning point for them, offering invaluable, empowering insights into how to avoid and fix 5 mistakes men make in bed. And 2, never miss out on exclusive, trustworthy men's health and wellness advice and the latest breakthroughs from leading experts, all meticulously crafted to empower men. Please hit that subscribe button and ring the notification bell right now